I have this funny story. I used to use this word interoperability. And the place where I was at using the word, people would always be like to me, "Melissa, we don't understand you. What does this word mean? This is a bad word for us." So that was my immediate reaction, that I'm just so happy that there's a pervasiveness of this idea that we need to exchange data. I bet there's a bunch of skepticality right now in the market just because of what's been happening in the government with all the different agencies and funding being taken away, that maybe some people are like, they don't mean it, but I hope they do.
You have to slice and dice it and look at these details and what they're saying behind the words. The first sentence in the summary is about effective and responsible adoption for patients. So it's a very patient-centric document. Some of the minds behind it were behind the Blue Button Initiative. They're actually asking for deeper input on how they can make that meaningful and useful and helpful healthcare data available in more places. If they're getting what they want out of this, there's an increased focus on digital health, and that's needed a bigger platform for a very long time. Where I thought it was lacking is that it doesn't really mention health equity, social determinants, health-related social needs, and things like that. I think that that's a miss, especially when we're thinking from the document that comes from CMS, heavily focused on Medicare. I'm actually pleased by seeing, hey, we're asking about technology decisions with a 65 plus population or with an economically underserved population. So very good that these voices are coming to the fold, but I do wish that there was a little bit more direct language about SDOH and equity.
Well, I know that for many places right now, some words like equity and DEI are still no-no words on the no-no list. Let's be a little moment rational and a little less politically correct if we can. What is the major purpose of sharing data? It's to find opportunities where there are SDOH needs that are being unmet. Some of your basic healthcare tenets and data measures like your A1C, your weight, your BMI, those things just get captured. The things that aren't captured are like food insecurity, homelessness. Those kind of pieces are some of the most important elements of understanding the human condition to be able to make their life more hopeful and more healthy.
I see this as a call to the fam. If you're working in these particular spaces, I really think that this is an opportunity to submit your response, to share that you submitted a response. You let us know that you submitted a response, and we would be happy to shout that out.